So the CHECKMATE-275 trial was a clinical trial studying single-agent nivolumab for patients with metastatic urothelial carcinoma. These were patients treated in the second-line setting, so they had failed prior treatment for their urothelial cancer. And there were groups of patients, a large group that were PD-L1 low and PD-L1 high. The results of this trial suggested response rates in approximately 20% of patients. And while some trials have suggested greater responses with PD-L1 positive tumors compared to PD-L1 negative tumors, we did see some difference, but perhaps not as great as other trials, suggesting clinical benefit in PD-L1 tumors with response rates around 16%. At this year's ASCO 2019, we present 3-year follow-up data, which is pretty amazing in and of itself. In historical chemotherapy trials, if you got to 3 years, it was truly shocking to have patients live that long. So I think it's an exciting time to have trial results where at 3 years, we're still seeing evidence of clinical benefit with immune checkpoint inhibitor. One of the most important parts of the poster is the landmark analysis that looks at patients who completed 12 months of treatment and are still on therapy. In this landmark analysis, we looked at the impact of response, because one of the big questions is, does it matter the depth of response that you achieve with an immune checkpoint inhibitor? I personally have patients with partial remissions that have been ongoing for over 3 years. So some have argued maybe partial response is enough, and should we aim for complete response, or do we increase the risk of toxicity by continuing patients on treatment? As a result of the landmark analysis, we do see some separation of the curves where patients who achieved a clinical complete response to treatment appear to be living or having survival advantage better than what patients had PR or even stable disease. I think we still need longer follow-up to see if these survival curves are statistically significant, but it does provide some intriguing evidence that the degree of response may matter, and perhaps we need to work toward achieving a complete response in patients, especially if we see that it translates to a survival benefit. At this year's ASCO 2019, we also see some results from pempeg-aldesleukin, which is an IL-2 analog which stimulates lymphocyte production. There was some data presented in the biomarker session looking at biomarker outcomes for patients receiving pempeg-aldesleukin plus nivolumab, both in melanoma and in patients with metastatic urothelial cancer. It's intriguing to note that in both of these tumors, we're seeing response rates that appear greater than what we've achieved with single-agent nivolumab. Arguably, the numbers of patients are small, and these need to be treated in a larger sample size to see if the benefit remains. But in the setting of bladder cancer, we're seeing complete response rates of about 19% for bladder cancer, with an objective response rate around 45%. And in the setting of melanoma, the complete response rate was 34%, which is really a quite impressive response rate. So if response does matter, then I think we do need to study these additional combinations to see if we can impact the long-term survival for our patients.